Today I'd like to discuss a common question that we get regularly and to describe what does it mean to do the procedure under local anesthetic. Local anesthesia in comparison to general anesthesia. General anesthesia is where you are in a hospital setting, in an operating room, and they put you to sleep. And there may be somewhat of a misconception of what this means to put you to sleep, because some people think this is just a great thing. You get to put to sleep and you wake up and everything's done. The downside is that when they put you to sleep, what actually happens is you stop breathing. The medication that's used is propofol, which is the medication that killed Michael Jackson. What happens with this medication is actually stops you from breathing and stops your bodily functions, and the procedures need to be done in a hospital setting with the presence of an anesthesiologist who will be putting a tube down your throat to help breathe for you. Obviously, there's a lot of risks and potential complications with the general anesthesia, so it's a great thing that we are able to do this under local anesthetic, which completely eliminates the need for general anesthesia. Local anesthetic, what this means is that you are awake the whole time. We are only numbing the area that we're treating. And the advantage to that is you're going to walk in feeling great and you'll walk out feeling fine as well. There will be no issues with general anesthesia. There'll be no issues with nausea and vomiting. There'll be no issues coming out of anesthesia. And more importantly, all the risk factors are eliminated. So what exactly does local anesthesia mean? What are we doing? And what we do with the local anesthesia, we're going to be making the tiny adit holes, little puncture holes in the various areas around the area that we're treating. Through these access points, we pass an instrument called a cannula, and we can pass this instrument under the skin, and it sprays the fluid, and the fluid is what's going to get you numb. Now the fluid consists of saline, which is simply salt water, lidocaine, which is the numbing medication, and epinephrine, which is the medication which helps to constrict the blood vessels and essentially push the blood away from the area to decrease potential blood loss during the procedure. This has revolutionized liposuction and made this significantly safer, significantly more efficient, and significantly cheaper for the consumer. So it's really been a great thing over the years. And it's only gotten better. With the local anesthetic, we are only numbing the area that we're treating, which means that the patient can move in whatever position that we need them to be in to get the best results, which is a problem when you're asleep. When you're asleep, you're stuck in the position that you're in, and it makes it very difficult to accomplish the positions that you really need the patient to be in. And where this really becomes a problem is when you're treating the sides for love handles or flanks or back bra roll. It's very difficult to get a patient that's asleep in a position on their side where you need them to be. So what typically happens when plastic surgeons put patients to sleep, they will try to accommodate and make do with whatever position the patient's in, and the consequence is that they end up doing a poor job and end up missing fat and not removing as much as they'd like to remove, and not getting as smooth or even results as they'd like to get. So this is definitely an advantage of local anesthesia, that the patient is awake and will be able to move around, and not only that, they'll be able to tell us if there's any problems. For example, while it has never happened here at MyShape Lipo, it is theoretically possible for the cannula to pass into the muscle or into the bowels, which could be disastrous. When you're awake with local anesthetic, we are able to numb only the fat layer. So the muscle layer beneath is not numb. So what that means is that if we go out of the fat layer into the muscle layer, you're going to feel it. And it may sound bad that you're going to feel it, but the reality is you're going to tell us that you feel it, which means that it's safety from our perspective. We will not get out of the fat layer, and if we do, the safety mechanism is you telling us that we're in the wrong place, that it's uncomfortable, and we need to fix the issue before it becomes a problem. And that's safer for you, safer for us, and all around a better deal. So In conclusion, local anesthesia is significantly safer and more cost-effective than general anesthesia, and I highly recommend it to anyone, my friends and family. I would never let them go under general anesthesia for purposes of liposuction.